Now that you are preparing to be discharged from hospital, we would like for you to listen to these instructions to help you continue to recover at home after your surgery. Be prepared to jot down any questions that you may have, and feel free to ask your nurse or doctor. Gynecological surgery can be performed through different approaches. Abdominal, through an incision made on your abdomen. Laparoscopic, through small incisions made on your lower abdomen and around the umbilicus. Or vaginal, through the vaginal canal. All approaches are considered major procedures and require you to be aware of how to care for yourself once you have returned home. As you recover from your surgery, it is important you follow these activity guidelines. Remember to increase your activity gradually and slowly. Activity is helpful for healing if it is done properly. Start by walking around the house. Then start going for a short walk and gradually increase your walking by a couple of minutes each day. At any point, if you have increasing pain or bleeding, you need to slow down your activity. You will feel fatigued and tire easily until your energy level improves. Rest frequently or as much as possible. Feeling tired is normal. You will need 6 weeks after your operation before you can be fully active. During this time, you should make arrangements for friends and family to help out with the housework. During the first 6 weeks of your recovery following surgery, it is not recommended that you lift or carry any objects over 10 pounds. These may include heavy grocery bags, laundry baskets, and even small children. The only exception to these lifting restrictions is if you've had laparoscopic surgery without a hysterectomy. Other activities that you should avoid include vacuuming, vigorously exercising, and even driving your car. Your discomfort and use of pain medication may limit your ability to react promptly or press firmly on your brake if necessary. You will have a follow-up appointment with your surgeon. At this time, you can discuss if you are ready to increase your activity and/or return to work. It is often asked if it is okay to do stairs following surgery. The answer to this is yes. You may use stairs, but climb them slowly and cautiously, always holding the handrail or banister. Do not place yourself in a situation where you may be more likely to fall. Always wear non-slip footwear and ensure stairways are clear prior to taking them. If you have any questions or concerns during your recovery at home, please call your surgeon's office. If you are calling after regular business hours, it is best to call the London Health Sciences Centre at 519-685-8500. Press 0 and ask the hospital operator to page the gynecology doctor who is on call. If you need immediate medical attention, go to the emergency department of the hospital closest to you. We are going to review when you need to react by contacting your surgeon or heading to your nearest hospital's emergency department. This section will cover problems or concerns regarding pain, bleeding, bladder, bowel, and signs of infection. It is normal to experience some pain after surgery. However, if you notice that the pain has increased and it is not relieved by pain medication, react. If you experience pain or burning upon urination, react. If you experience pain or swelling in your legs, react. If you experience nausea and/or vomiting after taking your narcotic pain medication, you can see if your pain is managed by only taking over-the-counter medication, including ibuprofen, known as Advil, and acetaminophen, known as Tylenol. If this does not work, or if you experience nausea and vomiting not associated with the pain medication that becomes persistent, call your surgeon. You must also not drive, operate machinery, or drink alcohol while you are taking narcotic pain medications. It is normal to have some vaginal bleeding or spotting for up to 6 weeks after your operation. You may also notice small pieces of dissolvable suture material in your vaginal flow. This is not uncommon and is no cause for concern. Your flow may be red or brown in color and it should gradually decrease in amount over time. You may use sanitary pads only. Avoid using tampons. Remember to continue with good perineal hygiene to prevent odor or infection, and change your sanitary pads frequently throughout the day, even if they are not completely soiled. If you have had a hysterectomy, you will no longer have menstrual periods. If you experience any sudden increases in vaginal bleeding and are soaking through one pad or more in an hour, or are passing any large-sized clots bigger than the size of a toonie from your vagina, react. If your incision separates or begins to bleed a large amount of bright red blood, react. If you notice blood in your urine, react. Depending on the surgery you had, your normal bladder routine should resume within a few days. If you experience difficulty emptying your bladder, or if you find that you are having to pass small amounts of urine often, react. These could be signs of a urinary infection. Your normal bowel routine should resume within a few weeks, but during your recovery, you will not be moving as much as normal, and this decrease in activity makes you at risk for getting constipated. Prescription drugs given for pain relief called narcotics can also cause constipation. If you are not passing gas or have not had a bowel movement for an extended period of time, react. Unless your doctor has discussed a special diet with you, you may return to your regular routine. Drink lots of fluids and eat foods high in fiber to reduce the risk of constipation. These could include natural bran, fruit and vegetables, and whole grain breads. Your bowels may require a little extra help from stool softeners or mild laxatives such as milk of magnesia. These are available by prescription or over the counter at your local pharmacy. A good diet is also important for wound healing. If you develop pain or swelling in your legs, difficulty breathing, and/or chest pain, you should go to your nearest emergency department or call an ambulance. Infection is a potential complication after surgery. This is most likely to occur 7 to 14 days after surgery. We don't expect that you will, but if you have any of the following symptoms, you will need to seek medical attention. Fever over 38 degrees Celsius or 100.4 degrees Fahrenheit. The chills. Foul-smelling vaginal discharge. Difficulty emptying your bladder and burning while you urinate. Yellow or green milky discharge from your incision sites. In this section, we will review how to care for your incisions. You may be discharged home with staples in your incision. You will be instructed as to when they should be removed and by whom. Most likely, you will be given a staple remover to take to your family doctor. Any sutures used in your incision will dissolve on their own. They are not visible and will not require any follow-up. You may also have steri-strips on your incision, which are sterile adhesive strips that may have been applied to help keep your incision closed. If this is the case, these should be left in place until they fall off on their own or for 1 week. You may shower daily, but do not scrub your incision. Instead, just allow the water to rinse over your incision, but avoid using harsh or perfumed soaps. Your incision should be left open to the air as much as possible. At this point, dressings or band-aids are not necessary, as exposure to oxygen in the air speeds healing. Avoid using tight or nylon underwear, as these could cause rubbing on your incision or possibly cause an infection. Clean and dry is best. Following the shower, pat your incision dry with a clean towel and do not apply cream or ointment unless instructed to do so by your doctor. Try and inspect your incision and how it is healing daily. Have others lift objects for you, as this could put strain on your incision and cause it to open. Both mild activity and resting frequently will also help your incision heal. As your incision heals, it is normal to experience discomfort with your healing incision. Some pain, tingling, numbness, and tenderness are normal and will take time to resolve. It is common to feel a large ridge or lump under the scar, which may also feel numb and tight. These are all normal responses and should all gradually go away in time. The edges of your healing incision may be slightly red, and some bruising around your incision is normal. Clear yellow or red-yellow fluid draining from the incision in the first few days after surgery is also normal. If you notice any of the following signs, you should notify your doctor. Redness around your incision that is increasing, warmth or tenderness around the incision, drainage that looks like pus, yellow milk consistency, or is foul smelling, separation of incision edges, bleeding, sudden gush of large amount of fluid from the incision. A laparoscopy is a type of surgical procedure that allows a surgeon to access the inside of the abdomen and pelvis without having to make large incisions in the skin. This is made possible using an instrument called a laparoscope. You may experience shoulder and/or abdominal discomfort for a few days. The small dressings covering your incisions may be removed the day after surgery, and the area should be left open to the air. If any suture stitches were used, they will dissolve on their own. You can also take a shower or bath the day after your procedure. You should not have sexual intercourse for the first 6 weeks following your operation or until it is comfortable for you. You can discuss this with your gynecologist during your follow-up appointment. He or she will let you know whether you can resume sexual relations as well as other forms of activity. Sometimes you may feel blue and cry for no apparent reason. It is not uncommon to feel this way following your operation, as you adjust to all the physical and emotional changes. If you've had your ovaries removed, you may experience menopausal symptoms, such as hot flashes or mood swings. You may want to discuss with your gynecologist whether hormone replacement is recommended for you. But don't worry, a good cry isn't going to hurt you. It is important to let someone know if you are feeling worse, feel like you are unable to cope, or have any thoughts of harming yourself. A hysterectomy is the removal of your uterus. If you've had a hysterectomy, you will no longer have menstrual periods and you will not be able to become pregnant. You may or may not need pap smears, as this depends on if your cervix was removed. Your healthcare provider can discuss this and other changes with you. Menopause means the end of a woman's menstrual periods, which typically is a gradual process. However, if you've had your ovaries removed, you may start what is called surgical menopause. This happens when a premenopausal woman has her ovaries surgically removed in a procedure called a bilateral oophorectomy. This causes an abrupt menopause, with women often experiencing more severe menopausal symptoms than they would have if they were to experience menopause naturally. If your ovaries have been removed, menopausal symptoms you may experience can include hot flashes, mood swings, sleep disturbances, vaginal dryness, etc. You can find help and more information you can trust about menopause symptoms and treatment on the following recommended internet site, menopauseandyou.ca. When you are feeling up to it, call your surgeon's office and book a follow-up appointment to be seen 4 to 6 weeks after your surgery. We hope that this information you received today will help you with your recovery at home. However, if you have any concerns or are uncertain about anything, please do not hesitate to contact your surgeon's office. Remember, if you are calling after hours, call the London Health Sciences Centre at 519-685-8500, press 0 and ask the hospital operator to page the gynecology doctor who is on call. If you need immediate medical attention, go to the emergency department of the hospital closest to you.